So our next speaker is Professor Rolf Zinkernagel. I'll read you just a little bit from his CV. After working as a surgeon for a little over a year, Professor Zinkernagel chose to focus on immunological research, undertaking a postgraduate course in experimental medicine at the University of Zurich, subsequently spending 2 years at the Institute of Biochemistry of Lausanne, working on immunity against infections. From 1973 to 1975, he became a PhD student, postdoctoral researcher at the John Curtin School of Medical Research at ANU, and some months ago I was there and I had the opportunity to hear quite a lot about him. It was there, of course, I think you will know, where working with Peter Doherty, he made seminal observations on how cytotoxic T cells recognize virus-infected cells in an infected host. And I think you know that he won the Nobel Prize for Physiology or Medicine in 1996. It's a great honor to have him here. With the inspiring title, Nano Hope and Coevolution. Professor Zinkernagel.
Thanks for your kind introduction and thanks for the invitation. Now, I originally wanted to put up a title, Nano Hype Hope and Co, but then people said you can't do that. Okay, so I come from, I'm a simple MD, and I've always been interested at how efficient immune responses get induced. And my conclusion of today's small talk is that nano has been around for a long time, before we called it nano, of course. And viruses, bacteria, classical parasites have one thing in common, and that is that they have multimeric identical determinants on the surface all the time. And that distinguishes them from our own antigens, because in circulation and in lymphatic tissue, all the structures that are available and accessible to B cells particularly are basically non-multimeric. The biggest multimer that is in blood, plus or minus, is IgM, which is a decamer. But you know that the IgM has a very peculiar structure, so it is like a starfish when it's not bound, and it sort of claps in the arms once it's bound to a surface. So, and only that is then activating complement and so on. So, infectious agents are multimeric, usually in the 30s, 50s, hundreds, thousands, identical determinants, as depicted here. And you see here in a negative stain, antibodies are bound to the surface, and you can easily imagine the size, of an antibody versus the glycoprotein. So things are a bit like my fingers, on the surface. The structure of the glycoprotein corresponds roughly to one of my fingers, and the immunoglobulin is actually of comparable size. So you can easily imagine that it's almost impossible for an antibody to squeeze in between the glycoproteins, which basically says that a virus surface simply consists of one antigenic site accessible to, for example, B cell receptors or antibodies, which by definition explains, what a serotype is, namely that a polio 1 virus induces neutralizing antibodies that neutralize polio 1, but they would not bind or neutralize polio 2 or 3. And of course, serotypic definition gives us the information about protection. So that's my conclusion. We can, in very general terms, not do better than evolution by using the same tools as evolution has used, but we certainly can do much better if we introduce new tools that haven't been used by evolution or coevolution. I just put down a few examples: antibiotics, antivirals, autoantibodies. But the most important ones in terms of medical consequences, of course, is education, because that hasn't been invented by evolution. And we all know that education and actually, take consequences of what we have learned is the most difficult thing. I mean, antibiotics is easy, but we know to follow a strict regimen for antibiotics is almost impossible. So let's just go through a few basics in immunology, and then I'll make basically 2 points. But you see, immunology is about specificity, so-called tolerance, and so-called memory. Now, all these things here are ideas. They cannot be measured. What we can measure is immunity, namely serotype correlated protection. We can't measure tolerance, but we can measure no response. And for memory, we only measure protection. Memory is just a vague idea. So if you look at how the system works, then again, keep this in mind here. Viruses, but you can translate that to bacteria, classical parasites, infect cells, and there are two possible outcomes. Either the virus is cytopathic, and these viruses kill you within 5 to 10 days, and then legs are up. Or the virus infects cells, but there is no pathological consequence to the cell. And there are many more of these types of infections, of course, because neither the virus nor the host really has an interest in developing cytopathogenicity. Now, it's clear that in this case, an immune response actually is not wanted, because, for example, the T-cell response against an infected cell actually causes damage of the cell, and that's basically pathology. Hepatitis B, hepatitis C, HIV, those are classic examples. Of course, in this case, with cytopathic viruses, the issue is completely different. Without a prompt immune response, you're dead. And there, the most important aspect is that you need to cover up the viral particle with so-called neutralizing antibodies, because that prevents the virus from docking to the next cell and causing further pathology. Now, if you look at an infected cell or a viral particle, and I take again the example I already showed you in negative staining, which is a rhabdovirus, that is, for example, rabies virus or vesicular stomatitis virus belong to that group, but you can extend that to any of the classical acute cytopathic viruses. I want to show you some experiments that demonstrate that actually the fingertips are the only accessible sites. And for that, a PhD student in the lab, his name is Hans-Peter Rost, tested polyclonal primary sera after infection from cows, humans, from lab accidents, rats, mice, whatever. And you stain virus or infected cells with such a complex serum. And then you ask, can any of 50 monoclonal antibodies that all are high-titered neutralizing antibodies, can any of these monoclonals compete that polyclonal serum binding or antibody binding down to background? And this is in fact the case. So you add excess of a monoclonal, that huge staining simply goes to the background staining, which basically says that one monoclonal can compete away an undefined polyclonal serum with thousands, if not 10,000s of specificities. Needless to say that any of the 50 monoclonals competes with any other, which means on my fingertips or the virus equivalent, there's just room for one footprint. And there are no two independent neutralizing antibodies that can bind to the same fingertip. Oh, I did a... Okay, now, so that makes things really easy because the construction of this nanoparticle is such that only one site is accessible. So all the other antibodies, you simply can forget about them. Now, if we look at cytopathic viruses, and here we just use vesicular stomatitis virus because we have distinct serotypes like in polio 1, 2, 3, and look at the general amounts of immune responses we can measure over time after infection. And what you see, virus replicates, you get T-cell responses, and you get neutralizing antibodies that are extremely prompt. By day 2 or 3, you have a tremendous IgM response already, switching to IgG by day 6 or 7. You have neutralizing antibodies or ELISA antibodies with exactly the same kinetics, no difference. Now you do the same analysis with a virus that is non-cytopathic, doesn't destroy host cells, such as HIV, hepatitis B, or in the mouse, a mouse-specific virus which is called lymphocytic choriomeningitis virus. Doesn't matter. It's like HIV or hepatitis B. And what you see there is virus replicates, there's an enormous T-cell response like in HIV. There are tremendously early and fantastic amounts of ELISA antibodies. But the neutralizing antibody response takes somewhere between 100 and 300 days to come up. Now, of course, it doesn't matter because the virus doesn't kill you anyway. It's the immune response against the virus. So actually you want to avoid an immune response. And the only time you can avoid an immune response is very interestingly before or at birth. Because mice and we and chickens, everybody is born without a functioning immune system. So all these types of viruses actually jump from the virus-carrying mother to the offspring either before or at birth via this blood transfusion that occurs during the delivery. And there, the offspring has no immune response, and therefore there is no immunopathology. But this also explains why it's not necessary, in a way, to make a neutralizing antibody response. And it reflects probably a repertoire defect, a hole in the repertoire of the B-cell response, whether this is because the virus tip corresponds to a self-antigen or is very close to a self-antigen, and therefore there are no B cells to do that, is another question. Things are not that clear. But I show this here with this early ELISA and the late neutralizer, and for hepatitis B and HIV, it's absolutely identical. And of course, again, it doesn't matter because the virus is non-cytopathic and therefore doesn't cause harm. It's actually the immune response doing it. Not all the HIV people, agree with that conclusion, but that's how it looks. Now, when you look at just simply mice, you can't do that with humans, of course, but if you keep mice either under germ-free conditions or under so-called specific pathogen-free conditions, that is hygienically very clean situations, and you take the normal serum and you take this normal serum before any immunization and make a neutralization assay, let's, for example, take against this rabies virus-like virus, you find there's a titer of neutralization of about 1 in 20 to 1 in 40. And you remember from med school or early lectures that what do serologists or immunologists do when they get a serum? The first action is to dilute that serum 1 in 40. Why? Not to see that what is called background binding. It's not background. You see, because if you take that normal serum and you absorb it with a serotype, let's call it serotype VSV Indiana, make packed virus, absorb it, take the supernatant, test it back on Indiana, titer is gone. Not 1 in 20, less than 1 in 2. But now you test it on the second serotype, which is VSV New Jersey, still titer of 1 in 30. So this is not background, this is highly specific, high quality, high affinity, 10 to the minus 9 neutralizing antibody. Now if you do the same test with this non-cytopathic virus, you never at the beginning can measure a neutralizing titer. It's less than 1 in 2. Same true for HIV, same is true for Hep C, for example. That means if you take a starting titer in normal serum before exposure of, let's say, 1 in 20 to 1 in 30, and you then go after immunization and you test and state your titer necessary for protection, then the titer is 1 in 600. Which basically means you just have to lift a titer of 1 in 20 to 1 in 600 and you're protected. That's only a factor of 30. That's actually very, very minor. But that can be basically generalized. For the others, the LCMV or Hep C, the ones that take 100 to 300 days, there is simply nothing available, and therefore it takes a tremendous amount of time to push the B-cell response through what is called affinity maturation. That is, by somatic hypermutation, the B-cell receptor sort of improves its affinity, and by the time the affinity is up to level, the virus has mutated away. So it's a, sort of ping-pong play over 100, 200, 300 days, and the virus is always ahead of the immune response, and that, of course, the big problem with these types of viruses. Bacteria are the same. Now, you can easily take a mouse that has no antibodies, the mutant mice that have simply no B cells and no antibody production. And you see with a virus such as this rabies virus, you give a few PFU, all die. And you simply give to that mouse a half a milliliter of normal serum, and you revert that to survival. And you can titrate that. There's a massive effect of, let's say, an LD50 shift of 10 to the 4, 10 to the 5. So these natural antibodies have an enormously important initial function to actually home the virus into lymphatic tissue via the binding to Fc receptors. So I summarize at this point. B cells react against multimers. Multimeric self-antigens are not available or not accessible to B cells, but of course there are multimeric molecules like collagen or DNA, and you may remember that those molecules are favorite targets for autoimmunity, because they fulfill these exact conditions. A monomer usually does not induce a B cell. It always needs something in addition, like these toll-like receptor types of second signals, and then a monomer works like a charm. You always need secondary lymphatic organs. Without lymph nodes or spleen, nothing happens. and that there must be a size of the antigenic structure of roughly 8 to 12 amino acids. Smaller simply doesn't elicit high enough affinities or avidities for efficient. B cells do not react if there are no B cells, of course. If there is a monomeric antigen but no T help, now all the serum antigens, serum albumin, all the immunoglobulins, all the hormones, etc., those would be monomers or maybe dimers, but there is no T help because the T helper cells have been deleted during the process of so-called immunological tolerization in the thymus. So there is no T help, and therefore monomers will never induce an immune response because with these self-antigens there are also no, toll-like receptor types of happenings. Now, the follicular structure, as I've said, is absolutely important. There is one interesting exception, and this is the local mucosal IgA in the gut mucosa or the respiratory mucosa. There you get that local IgA even without complete absence of secondary lymphatic organs, which basically seems to indicate that the local IgA is like an ancient type of antibody response and probably was the first sort of adaptive type of immune response. But that's a speculation. And of course, if the antigen is too small, nothing happens either. Now, so that basically says nano multimeric structures are key for triggering B cells. The interesting part there is, and we did some rough calculations, is that the distance from site to site is in the order of 7 to 10 nanometers. And this corresponds just about to the span of the dimeric, binding arms of an immunoglobulin, which is interesting. But nobody so far has measured, the triggering levels and some calcium flux or something to actually document that. Now, the second point I want to make is that nanoparticles with multimeric structures can actually induce immune responses that you don't want to induce. So there's no such thing as a free lunch, even in biology. Always things have a cost side. Now, no immune reaction, for example, in viruses, can be seen in papillomavirus infections and, in the peripheral skin. You initially don't make an immune response because the virus, simply keeps out of the draining lymph node or the spleen, at least initially. That makes it a very special ecology. Or the second one is if the virus is everywhere. And this, as I've indicated, is the case for these non-cytopathic, non-cell destructive viruses that are transmitted from mother to offspring at or before birth. Hepatitis B, hepatitis C, HIV, in our mouse case, this LCMV. And there, the virus is simply taken as self. There's no differentiation. And the immune response is simply not yet available. And during maturation, all the specificity for that virus infection gets deleted. But that's now the question. So, when do we have B-cell responses and when do we have no B-cell responses? As I've said, monomer without help or no multimer is sufficient not to kick off the B-cells. If you have no follicular structure, the same. But now, classically in immunology, that you either have the cell and then it can potentially react, or you don't have them, and we call that deletion. In the thymus for T cells, in the for the B cells, people like to quote the bone marrow. But let's see whether this is really true. So, if you take a mouse, the strain is 163. And this mouse was made in the lab of Arnheiter at the NIH. He made a mouse that is transgenic for the glycoprotein of our favorite virus. So it's transgenic for this glycoprotein. And in fact, it has glycoprotein in the spleen, in whatever these organs are, because if you mash that up, inject it into a normal mouse, you will get antibodies, neutralizing antibodies against that transgene. So the stuff is around. And now you take glycoprotein from the virus, mix it with complete French adjuvant or any other sort of, immunoboosting agent, and you immunize this transgenic mouse, compare that with a almost chondrenic black 6 mouse, day 4 primary IgM, not measurable. Here it's titer 3 to 8 in a log 2 type of titration. Day 20, you do the same. Huge difference. Day 4, after a secondary, you immunize again. You don't get a response. You get a fantastic response with the control. So you say the mouse is tolerant. The B cells can't be there. This is not true. Because if you now take the viral particle or the wild type infection, but you simply can UV irradiate or formaldehyde fix the viral particles and inject those, and you see on day 4 you have a very good IgM response that is neutralizing. So it's directed to the tips. It's not quite as good as the control, but almost. And you do it at day 20 or after a boost, perfect response. So that tells you a mouse, at least with that model antigen, doesn't care by immunization with a monomer, even with French adjuvant. But as soon as you bring in the multimer with these specifics, of 7 to 10 nanometers distance, at least 30 of these multimers, then you kick off the response immediately. Now, this tells you that the difference between this type, the nano response versus the monomer response, is simply linked to T help. And you can easily demonstrate that by taking the T helper cells away. This response goes, but this response stays. Conclusion. B cells that would not react against the monomer, even under so-called classical immunogenic conditions, go off like a rocket if you bring in a particle with multimeric surface configuration of the 7 to 10 nanometer distance. And the same is actually true, and this sort of has an impact on our thinking on rheumatoid arthritis or lupus. You now can think this being a surface of a bacterium with some polysaccharide chains. Some are closed, some determined, some are far away from a membrane. And you now can check, and this is Thomas Fair who did the experiments, you can make monoclonals against membrane-prone determinants or very distant ones. The distant ones, of course, the polysaccharides are very mobile, not as rigid as on a viral surface. There you almost never can make antibodies easily. The closer you get to the membrane where things are stiff and fixed, the better. But you even can show that if you make antibodies against repetitive foreign determinants, the host starts to make antibodies against the antibodies that already have bound. And that, of course, strikes your memory of rheumatoid factors. So, what is interesting on the protective side may actually be a disadvantage if one wants to use the tricks of nature. Again, I've tried to address two sides of the medal. One is induction of these IgM B-cell responses in the absence of T-help by these multimeric determinants, very efficient, as long as these determinants, obey certain rules. But this, of course, has the disadvantage of inducing immunopathological or autoimmune type of responses. So Nano has been used in evolution, and I think they are very important because of the multimericity in inducing an efficient early response. And you all know that the toll-like receptor types of triggers also are basically dependent on multimerization. And of course, we can apply some of that in vaccinology and to improve B-cell responses. But with the costs of inducing an unwanted autoimmune response. And I think that is not only interesting, but we have learned a lot about the immune system by just simply following these viral particles. And it also shows it's nice to use biological antigens instead of academic antigens, such as hen egg lysozyme or bovine serum albumin, because I think the biologically relevant types of viral or bacterial or parasitic antigens teach us a lot about the system. This is a small summary of about 20 years of work, and this was the group at a lab reunion party 3 years ago when Hans Hengartner, with whom I've shared the last 30 years in the lab, and I myself retired from official duties. Thanks very much.